Hello, this is Dr. Nathan Way, and today I'm going to talk about how to deal with ankle sprains. Ankle sprains are very common. It's been estimated that 25,000 ankle sprains occur every day in the United States. The diagnosis is made primarily by history and physical examination. Nowadays, we'll sometimes use diagnostic ultrasound or MRI if we suspect that any of the ligaments have been badly torn, because that will change the treatment approach. What are the treatment goals? They're pretty straightforward. They're to relieve pain and prevent instability in the future. So let's talk now about treatment. The age-old remedy for a sprained ankle has been RICE: rest, ice, compression, and elevation, and that usually is sufficient for mild to moderate sprains. Unfortunately, that may not be enough. Specific exercises to strengthen and stabilize the ankle are often required. Patients who have moderate to severe sprains may have partial tears in the ligaments, and that means that we'll probably have to do what's called a percutaneous needle tenotomy with platelet-rich plasma, PRP. And what that procedure involves is making tiny holes in the diseased tendon using a very small needle with ultrasound guidance and local anesthetic or local block. And making these tiny holes starts an acute inflammatory response, which really is the first stage in healing. The PRP, or platelet-rich plasma, is a concentrate of blood that contains a large number of platelets. Platelets are cells in the blood that have a lot of growth and healing factors. So once the little tiny holes are made, once inflammation is started, then the PRP is added using very careful technique with ultrasound guidance, and this leads to healing of the ligament damage. In patients with complete tears, this may not be enough, and patients may require surgery. Well, that's it for today. Thanks for watching. This is Dr. Nathan Way.